Hi, everyone. Welcome to today's webinar, Daily Strategies for Maintaining Your Emotional Well-Being During COVID-19. We're so glad you can join us to connect and learn during this stressful time. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You've joined the presentation listening through your computer speaker system by default. If you would prefer to join audio over the telephone, please just select phone call in the audio section of your control panel, and the dial-in information will be displayed. You can submit text questions at any time during the presentation by typing them into the questions box of the control panel. We will spend a few minutes at the end addressing as many questions as we can in the time we have. Any questions we don't have time to answer today, we'll respond to them separately and post them on our blog. The slide presentation is provided for you, or will be provided for you as a handout, which can be located in the handout section of your control panel before the end of the webinar. Before we kick off with the formal program, I'd like to first introduce Corinne Costa-Davis, the COPD Foundation CEO, to provide opening remarks. Corinne, over to you.
Thanks, Jamie, and hello, everyone, and thank you for joining today's webinar. A special thanks to our speakers, Michelle and Karen, and to the COPD Foundation staff members, Jamie, Stephanie, and Sarah, for making today a reality. Leaning into our emotional well-being allows us to move from emotion to cognition. This allows us to move from fear to a calmer, more functional place. That's what today's conversation is all about, and it's just so important for us to take that approach. And our collective actions at the COP Foundation are our collective commitment to you, our community. Just would like to remind you to continue to visit our website, where we continue to post important information and updates, and enjoy today's conversation. Back to you, Jamie.
Great, thank you, Corinne. So first, just a quick reminder that the information presented on this webinar should not serve as a substitute for medical advice, and any content discussed should not be used for medical advice, diagnosis, or treatment. We encourage you to please consult with a physician before making changes to your own COPD management plan, or if you have any questions about COVID-19 symptoms. So what are we talking about today? Today, we will be taking a more in-depth look at why self-care is so important for people with COPD and learning some practical strategies for coping with the effects of COVID-19 related stress, anxiety, or depression. You will hear from two fabulous speakers. First up is going to be Karen Deidemeyer. Karen was one of our first state captains and is a member of the COPD Foundation's Patient-Powered Research Network Governing Board. She's also involved in countless other COPD and community-based volunteer efforts, constantly going above and beyond to make sure people with COPD have a seat at the table for important discussions around care, research, and advocacy. Next, you'll hear from Dr. Michelle Eakin. Dr. Michelle Eakin is an assistant professor of medicine in the Pulmonary and Critical Care Medicine Department at Johns Hopkins University School of Medicine. Dr. Eakin has a background in clinical psychology and does research that focuses on community-based lung disease interventions that can improve adherence and reduce health disparities and other important topics. So thank you so much to our expert speakers. And without further ado, let's get started with Karen, who will frame today's discussion by sharing her own experiences with how she's maintaining her emotional well-being during this stressful time. Karen, over to you.
Thank you, Jamie, and thank you for inviting me to give my perspective. One of the first things I want to say is that I know none of us could have possibly been prepared for this pandemic, but if you put into effect the COPD action plan, then you hopefully had medications, you hopefully had necessities already in the house. And I started an exacerbation about 3 weeks ago, prior to COVID-19 being really publicized. I was able to start taking medication. I know my triggers. So when I found out about COVID-19, I knew I didn't have it. But this is extremely important when you can work out an action plan with your doctor. I live in Florida. We have hurricanes. At hurricane season, I have extra water, extra canned goods. When you can, try to prepare, try to get ready for that. I wasn't so likely to panic because I knew I had things in the house. One thing I have done is I have found that watching the news all day long is not good for me. I tend to panic when I see all this news. So yesterday I said, that's it. I'm only going to watch a few minutes a day. I switched the channel, and a lot of times it's totally off. But I found a channel that plays all the old, funny sitcoms. I Love Lucy, Petticoat Junction, all the silly programs from years ago. Well, they cheer you up. And social isolation. I have a friend who's also a COPD patient and a captain, John Linnell. He likes to call it physical distancing, not social distancing. We can still be social. We can call, we can text, we can FaceTime, we can Skype, we can go out in the front yard and see if a neighbor is outside. I like to open up my house. I live in Florida, so I am able to enjoy the outdoors this time of year. I know not everybody can. But last night I took my golf cart and I took a ride around the community, and there were people walking and people bicycle riding and people in their front yards. You know, we stayed apart, a good distance apart, but we smiled, we waved, we said, hey, how are you? Is everything okay? So we're still having that social connection. And then one more thing I want to tell you is we did a neighborhood in the street birthday party, 6 feet apart, for our 84-year-old neighbor across the street. We managed by texting and phone call to alert everybody on the street, and everybody came out at a particular time, and we surprised the heck out of him. And it brought such a smile to his day, and we all felt good because we saw each other from a distance, but we were doing something fun. And so I think, you know, I think that this is a time that we can come up with other ways to reach out. The COPD 360 is wonderful. Facebook groups, everything. It's helped me. I open up my house every day, let the sun in. The gloominess. I get very depressed if it's dark and gloomy. So I think that's important. And just knowing that we will get through this and we will be able to be together again physically and, you know, hug each other. But for now, there are other ways to stay in touch.
Great. Thank you, Karen, for sharing your personal experiences. We really wanted to start off today by letting people know and have that comfort that it can be to know that you're not alone in your feelings, and we appreciate your willingness to share your own experiences. So now we're going to turn it over to Dr. Eakin. And Dr. Eakin, thank you, and take it away.
Thank you so much. Thank you. I really appreciate the opportunity to speak to you today on this topic, and really appreciated Karen's opening remarks. I think she hit on a number of things that I'm going to bring into my talk as we move forward about coping strategies for people with COPD during this COVID-19 pandemic. You know, I think this is a situation and a time in our lives where it's impacting almost everything and every aspect of our daily life, and we're really seeing the emotional toll it can take, particularly for everyone, but I think it has a particular emotional impact on those with chronic lung disease like COPD. You know, to start off with, you know, people with COPD are at an increased risk to start for anxiety and depression. We see that they're more likely to have anxiety and depression with COPD than in other chronic conditions, with about 15 to 20% of individuals with COPD having either some anxiety or depressive symptoms. I think this has then escalated, particularly in today's world with the COVID-19 panic and stress around that might make us even more likely to experience these symptoms. Right now, we're undergoing a major stressor with this COVID coronavirus pandemic. I put social distancing, but I agree, we really can think of it more as physical distancing has limited our ability to have social interactions in some ways, and it impacts our daily activities. Things that we typically might have been enjoying, daily social activities that we might have done, like going to the library or going to the gym, are no longer feasible. We're encouraged to not attend other different family events or social events. And, there's been a limitation on how much we can spend with one another. In the light of this, we're also having an increased stress and anxiety, a worry about, one, our own personal health, the health of our loved ones. Will someone that we know or love test positive for this? And then as well as kind of the overall health of our country or community in terms of economic strife, concerns about our healthcare workers. Many will be concerned, as I am, about our physician and nurse colleagues who we love dearly, who are now being called to put out on the front lines to deal with this stress. And so all of these things together has really increased our likelihood to start to feel symptoms of anxiety and depression that will impact our daily life. And when we think about how this panic or stress response might impact somebody who has an underlying lung disease, there's a lot of things to think about. We start off with anybody with COPD, we have symptoms of shortness of breath. Those symptoms of shortness of breath can lead to us feeling fatigue or exhaustion, and we start to then trigger cognitive thoughts about this, whether it be, oh, I can't breathe, I'm getting sick, I'm going to end up in the hospital, I'm not able to do these activities, or, particularly in light of COVID-19, is this a symptom of the disease, or is this going to end up bad, am I going to end up in the hospital? Those thoughts lead to kind of an increased physiological arousal, and that is your body's response to stress. Your heart starts beating faster. You might start feeling it in your stomach, your muscles tense, you might get a headache, and more importantly, you start to have shortness of breath or breathing issues. So that arousal causes those panic symptoms. So now we're having increased shortness of breath, which might lead to increased fatigue and increased panic thoughts and increased arousal and increased panic. And so this becomes more of a cycle and less of a cycle and more of a spiral, that things become getting worse and worse as they move forward. Next slide. And so when we think about someone who has a chronic lung disease, this is a quote from a patient, it's hard not to get into a panic. I went into a panic one time at 3 o'clock in the morning because something had happened to his oxygen. And the quote at the end, it's scary when you can't breathe. And so the reason I think this is an important topic is dealing with this increased stress around COVID-19, as well as the impact it could have on our breathing, really can set up to be a spiral. I think this is particularly important for patients or individuals with COPD right now, because as you start to have these symptoms of shortness of breath and concerns about exacerbations, we also have a really increased concern about going to the ER or access to physicians. So there is this kind of, I think, a high likelihood of things kind of getting worse without really appropriate access to, with limited access to our healthcare providers with all the precautions around COVID-19. So we really need to think about how we can prevent it from getting to the point where we are in this spiral where our panic may be making our physiological breathing worse, and so on and so forth. Next slide. Furthermore, we see the same cycle, not just with anxiety, but with depression, where, that shortness of breath can lead to that fatigue and that withdrawal, that social, I don't want to participate in those activities. I can't do it. It makes me feel bad. And that then makes us feel depressed, which leads to us less likely to participate in daily activities because they're not as enjoyable. And then as we're not doing those activities anymore, it can actually decondition us and make us more likely to have pulmonary symptoms or make us more likely to have shortness of breath. So the less physical activity we're getting, the more our breathing is difficult, which leads to us avoiding more physical activity, thus making our breathing even worse. So again, it's a cycle that we want to intervene on to prevent making it worse. Next slide. And this is common for many people, but I think, for those with COPD, there are particular risk factors for this cycle. Not having a caregiver or a loved one for that lack of social support, having previous exposures to violence or other adverse events, sleeping problems, dealing with chronic pain, substance abuse, and as disease severity increases, you're more likely to have these anxiety and depression symptoms. Next slide. And so really we're trying to find a way that in the context of all this known triggers for stress, as Karen mentioned, your triggers for COPD, we also have triggers for stress, and we're all, every single one of us from children up to, the elderly are all having major triggers for this stress, and it's causing this stress response within us. And this is a physiological response to some kind of event in the environment. And these stressors can be a news report. It can be, just a lack of not being able to participate in an activity. It can be, concerned about loved one, whatever it may be. And it causes a physiological stress response in our body. And often we call this the fight, flight, or freeze response. So when in the context of some kind of stressor, and we can think about it in a more basic level of you're walking around and you see a large animal coming your way, really something very scary. You have three responses. The one is I can fight it, I can scare them off, and your body reacts to get in their face. The other one is I'm not that person, I'm going to get out of here, I'm going to flight, I'm going to run away. Or oftentimes we have this freeze response where we don't know what to do. And that stress response kind of creates, our bodies, that's a physiological response that we can't control. It happens naturally. Your heart starts beating, your hands get shaky, your breathing gets more shallow, you might start getting sweaty or clammy palms, whatever it may be. Those are all symptoms that it's really hard. It happens kind of automatically, and it's kind of the way we were, became, as part of our biology or anatomy. But as this stress kind of chronically happens, we have this increased arousal over time, that will take a toll on our bodies. It will reduce our immune system, make us more likely to get sick, which is unfortunate in this time. It can impact our sleep or our behaviors. It can impact our mood, and it can really overall just make reduce our overall quality of life. So we need to think about how we respond to that stress response to reduce its impact on us and to avoid having that spiral as we talked about. Next slide. So the first thing we need to think about is just making sure we're doing everything we can to take care of ourselves. Karen mentioned a lot of good strategies. Talking with someone, just because it's physical distancing doesn't mean our social networks have been cut off. We can still call, text, FaceTime, any of those things that you find well. Avoiding substances is good, alcohol, drugs, tobacco, things that may have a tendency to make that stress response worse. Make sure we're practicing good sleep habits. I know many of us who are now working from home, we might feel like we're able to give up our routines, but that's not the time. We really want to do our best to get enough sleep, go to bed at the same time, wake up at the consistent schedule. Get outside or in nature. As Karen says, enjoy that sunshine. We're fortunate it is spring, and although the weather is variable depending on where you live, I think there's brighter, sunnier days coming to most of our way, so enjoy that when it comes. Make times for things you enjoy. Many of us may have lost that ability to participate in social activities that we used to enjoy, but there are still some things we can enjoy that we can build in, whether it be a show that you enjoy, a TV show, a walk, time visiting with friends over the phone, things like that. Physical activity is still important as much as you can. And then, practice relaxation strategies. And then what I want to focus on today is how are we going to track our anxiety and depressive symptoms and kind of reframe and address those directly. But all of these components here need to be addressed first, and making sure that we're really prioritizing those before we can really dig into the meat of the other things that might be dealing to the anxiety and depressive symptoms. Next slide. So when we start to notice that we're having those anxiety and depressive symptoms, first thing is it is getting to a point where it is impacting your daily life. and you're really unable to function, it's time for a really evidence-based intervention to help address it. And there's no shame in this. I think sometimes when it's a mental health issue, there's more shame addressing it and reaching out. But, I think, to me, a mental health disorder is no different than a physical health disorder. So we wouldn't delay calling if we were having a COPD exacerbation. We shouldn't delay calling if we're having some anxiety and depressive symptoms. Unfortunately, in today's world, we might be limited in our resources, but I know many therapists now are initiating virtual therapy or telemedicine. And then as well as doctors are doing televisits that maybe they can address either getting some medications, an antidepressant or anti-anxiety medication. But, if you get to that point, and I know there's going to be resources at the end, we really do encourage people to reach out to those interventions as needed. Next slide. But today I'm going to talk about some of the basics that you can start doing today, to address these fears and these anxiety and depressive symptoms. And this is really the basis of it, is this idea of the thought, feeling, action. We start down here in this purple box, the situation. Things happen that we don't control. This is obviously what nobody had ever imagined would happen, or that we would ever be in this situation. But it's here we are. We can't personally change it, but we do have a reaction to it. And oftentimes it starts with our thought. So, and we interpret what's going on. And so, taking the basic of just turning on the news and hearing some of the stories that are coming out, it triggers some thought in our mind. Those thoughts lead to an emotional response, that stress response, or another, hopefully more mild, calm response, or a more reasoned, a response. And then as we have those feelings and thoughts, we act in a different way about that. And that may actually ultimately change the situation. So, you hear that the recommendations are to stay 6 feet away from people. You could have the thought, wow, I don't want to get sick. I better, your feeling feels a little bit in control, or maybe you start to panic. I don't want to get sick. But that might actually lead to a behavior of, well, I'm not going to go outside. That's just fine, and that actually might impact the situation that you might not get sick. On the other hand, you could have the thought of, oh, that's not going to apply to me, and I'm just going to go outside, like we've seen people do, and that might impact the situation. Move on to the next slide. I'm going to get into this a little bit more and how we kind of address this. But really wanted to kind of highlight that what I'm trying to say is we can't directly change the situation we're in right now. And we cannot directly change that physiological stress feeling, that stress response that just happened. And we're right now in a situation where that is normal. Given the circumstances, we're all feeling that. But we can start thinking about how are we thinking about the situation that might influence our feelings, and also maybe what are the behaviors we're choosing that might be influencing that response. And that's what I think Karen kind of hinted that or described, is that she realized watching the news was causing that panic, that she was better off turning the news off to reduce those responses. And that's going to be one strategy we'll talk about, and hopefully we'll give you some more on how else we can deal with this. Next slide. So these are some basic ones to kind of get you in the thinking about this. This is not, you start, you run up the stairs and you get out of breath. It's a normal situation for patients for individuals with COPD. You can have one thought, which is, oh no, I'm getting sick, or my COPD is worse. And you can think what feeling that's going to trigger. To me, that would make me anxious. It would make me worried. And you're going to have that stress response come up. Oh no, I'm getting sick. What am I going to do? I can't call my doctor. I can't go to the doctor. You could also interpret the situation. You run up the stairs, get out of breath. Wow, that was more steps than usual. Or, as Karen said, oh, wow, maybe I'm starting to have the start of the symptoms. I may need to, look at my COPD action plan. What's that feeling going to take? It's going to be a little bit more reasoned. It's going to be a little bit more in control. You might feel a little bit, less concerned. You might feel more, I guess I'm trying to come up with an emotion, but more pragmatic or logical about it. And it's not going to trigger as much that stress response. And so, next slide, the more that we can track those thoughts, the more we can start to change that stress response we might have. So how do we go about doing this? The first thing we need to do is we need to be aware. Just start tracking your feelings. And I often rate it on a 1 to 10. 1, relaxed, everything's okay. 10, I'm super anxious and I need help. I think right now, all of us, our day-to-day anxiety is running a little bit higher than it normally is. But we need to recognize, when are we getting really, really anxious? What's going on? When do we see those? And where would we rank it? So that we're more aware of when we're starting to have these anxious thoughts and that stress response. We have to track it to be aware of it. So that's our first step. Next slide. The second one is, once you start to realize you're having these anxiety thoughts or depressive feelings, it works both for anxiety and depression, same thing. We need to then figure out, what were the ABCs? And really, the activating event. What was the situation? What was going on before? The beliefs, behaviors, your thoughts. What was I thinking? And the C, the consequences. What happened next? And we really want to do this with no judgment. We just want to track it. We just want to see what we're doing. So if you go to the next slide. So going back to our ABC, went up the stairs and got out of breath. We can think a lot of things. COPD is worse. I'm going to stop breathing. I need to go back to pulmonary rehab. I might be getting a cold. I might be getting a COPD exacerbation. And that's going to change our consequences and our response. If you start thinking, I might be having a COPD exacerbation, you might look at your action plan and see what's on your plan. Do you start taking some albuterol? Should you call your doctor? Whatever it may be on your plan, and you've worked out. My COPD is worse and I'm going to stop breathing. That's going to create a panic, and you might be more likely to be like, I need to go to the hospital, which might be not a great decision right now. So you can see how just the same event, but the way you think about it might change what happens next. Go on to the next slide. So we can think about this in the light of the coronavirus or COVID. Watching the news. We start thinking, I'm going to get it, I'm going to die. This is getting worse and worse. I need to keep myself protected by staying indoors, or I just need to turn off the TV. You can see any one of those are reasonable responses, and we might have all experienced all of those. But each one is going to be linked to a different consequence. If you start to worry that I'm going to get it and I'm going to die, that panic and that stress is going to really increase. You're going to feel that response. Your heart will start beating, your breathing will be worse, and that might trigger that spiral. Versus choosing, I don't need to hear this anymore, I'm going to turn it off and go find something more pleasurable, might limit that response. And then that middle one of need to keep myself protected by staying indoors, that's going to create that more of a sense of a control. There's a situation that is out of control. We can't change it, but I can choose what I can control, and that's my behavior. And the more I physically distance myself and keep myself protected, the more I'm going to be in control of that. Next slide. So once we start seeing what's going on, how we're feeling about it, and what we're doing, like I said, the first thing, you just want to track it. You just want to track what you did. Then you can start to challenge yourself. You can look at what you're doing, what you're thinking, what you were doing before, what you did after, and say, what's under my control to change? Do I need to limit the exposure, like Karen said, turning off the news? Do I need to consider more positive thoughts? Do I need to reframe what I'm thinking about? And I'll talk a little bit more about that. Instead of focusing on what I can't do, like I can't go to my friend's house for a birthday party, focus on what I can do. I can have a neighborhood party in the street. Do I need to practice some relaxation or set up some pleasurable activities and social connections to improve my mood? And then as you start to think about those changes, track it and see, did it work? Because sometimes what we come up with, we're like, oh, that's going to work, and that it didn't. It makes something worse, and then you might need to tweak it again and see what we can do to make and reduce that response. Next slide. So another example of this, we feel lonely due to social distancing, and we can think, nobody thinks I'm worth talking to. This is not worth doing anymore. I don't want to do this anymore. I give up. And that depressing feeling is going to come. Those are going to be, that emotion is going to be depressed and isolated. And it might lead to withdrawal. or avoidance. Versus we can think, I'm keeping myself protected. I'm keeping myself in my community. I'm helping everyone out by doing this. I can't use my traditional ways of seeing people. I need to figure out a different way. Can I use FaceTime? Can I use something else to reach out? Can I find another way to connect with people? And as we start trying different things, keeping track on what was that consequence? What did I do differently that changed the way I think things are going? This is hard and it takes time. And so I always say you always start with just tracking. Just be aware what's going on. And as you start to track, you start to see, maybe I can make some small changes to make those to get those different consequences. Next slide. So these are things that I've had to do and come up with myself. As we've been all dealing with the news and everything, those stressful thoughts are coming. And I've had to really work on how can I reframe the way that I'm thinking to have a different consequence or a different emotion. So I'm sure we've all had this thought of, I'm stuck at home. Even though you may not have had anything you wanted to do today, still just that idea that you can't do it. I was talking to my 85-year-old father, and that's what he said. He's like, I didn't have anything to do, but just the thought that I can't do it is making me upset. Instead of saying that, I'm stuck here, saying I get to be safe in my home. That's a better place to be than a lot of other things. Instead of I'm going to get sick, that's going to cause worry. You reframe it to, I'm going to self-isolate, I'm going to wash my hands, I'm going to limit my exposure to significantly reduce my chances. I'm prepared for this. I will run out of food or run out of medications. As Karen says, I prepared for this. I have my COPD action plans. The groceries and the pharmacies are still open. There's a lot of resources available to get me what I need. Everything is shutting down. What a negative thought. We've all had that. Oh, goodness, what's going to happen? And really reminding ourselves, instead, the most important places are still open. Hospitals, doctor's office, pharmacies, grocery stores. You're still going to have things taken care of. There's too much uncertainty. And I think that's really the hardest one right now, we're thinking. And then really, instead of focusing on, I don't know what's going to happen tomorrow, while I can't control the situation, I can control my actions. I'm going to do what I need to do to have the best outcomes. And this changing of the mindsets and tracking our thoughts and how we can make them more positive, it takes time, it takes effort, and it takes reminding ourselves. But it really, as we become more aware of it, it results in a better positive experience. Before we started this webinar, I was catching up with Karen, and we were talking about the last time we were visiting, and we got to go to a conference together in San Diego, and we had a great time. And I made the comment of, oh, yeah, that was back before we could actually get together. What a negative thought. And it was Karen who turned to me and said, but we're going to get through this, and we're going to do that next time, and we'll look forward to doing it, and we have those memories. And what a positive reframe she put on that experience. And that really shows we all need to practice this. When we find ourselves in those negative thoughts, finding the way, how can I reframe it to the positive one to have that better emotional consequence or that better response, action, situation. Can you go to the next slide? So just as a kind of brief thing, I think what we can all start doing is really start thinking about tracking our emotions. If that's all you can do this week, that's fine. Find out when you start to feel those anxiety and depressive feelings and rate it and what were you doing. If you could just do that, you'll be a step ahead. Just being aware of what we're doing and when it's happening will be important. Once you get the hang of noticing that, once you realize, oh goodness, I'm having a hard time, then start thinking about what was I doing before, what was I thinking, and what happened afterwards. Just track, no judgment. And then as you get better at that, start thinking, how can I make this, what can I do differently? And so, as I've dealt with my own stress and my own family's response to the COVID, I've had to start realizing that I was not sleeping. And it was because I was reading the news before I tried to go to bed and get anxious. And I realized that wasn't a positive activity, it wasn't giving me, and it was causing the stress. So I too had to turn off the news, put away my phone, and pull out board games to play with the kids, or go for a walk to find ways to reduce, so that way I can notice that I'm, able to get to sleep as I need to. And so I really encourage everyone to start thinking about tracking, figuring out what's going on, and then start challenging what can I do slightly different to cope with this. Next slide. So in conclusion, I just want to say we're all dealing with this stress, and there's a lot of worry that's coming around with it. But the more we take care of ourselves first, we work on these strategies, practice changing our mindset or behavior, we can kind of see the sunlight, the silver lining through this. And hopefully we can all get through this, and it will improve, and we can make it to the other side of that, of this. Safely and supportive with everyone. So I appreciate everyone's time and interest, and thank you so much.
Thanks so much, Dr. Eakin, for the excellent overview of why emotional health is so important to people's COPD management and for really all of us, and for providing really practical strategies that I think we can all put into action in this time of increased anxiety because of COVID-19. So at this time, we're able to take a few questions before we wrap up the session with some reminders on some current resources that you can access. And so please, if you would like to ask a question, please type it into the question box in the GoToWebinar control panel. But before I turn it over to Stephanie to ask some questions, I just want to remind people that we've seen several questions that are more references to the medical management of COPD or risks from COVID-19. And many of those questions were answered on our last webinar from our medical doctor experts. And we are not necessarily going to be able to answer all of those today, but we have some great resources that we'll show you in order to get answers and make sure that you do find answers to your concerns. So with that, Stephanie, will you please ask our first question?
Sure. Dr. Eakin, this question is a common one. They said, my family doesn't understand that I really have anxiety on a daily basis, and now the anxiety is much worse. How can I help my family understand me?
Yeah, I think this is hard because, as I said, there is an increased stigma around mental health. People don't want to talk about it and don't understand it. And then I do think there's this kind of idea of you can just get over it, and not realizing that this is a disorder, disease, just like any other diseases that you're dealing with. And so and then obviously in the context of everything else going on, this is kind of increased and elevated in its severity. So one of the things we always encourage people is to really let people know the full impact of your symptoms, and discussing not just, we want to think about anxiety or depression as just something in your head, and really telling them and linking those, well, in my head, but then what the symptoms you're dealing with, and maybe describing how those anxiety symptoms really do trigger your breathing problems, so that they kind of understand how these are linked together. One of the doctors I work with often says, your head bone's connected to your body, your physical bone, it's all connected. And so the more that, they understand that as the anxiety symptoms impact your health and your breathing, they might be more understanding of it. Number two is, I do think that, in terms of getting that support, is really letting them know what are the anxiety symptoms you're having, and maybe even talking about the situations of, this is, if I were to put it on a scale of 1 to 10, this would be a 9. This is the highest I've had. This is really letting them know what the concerns are and what's triggering it, so that they're kind of aware of what's going on. And then I think, is kind of addressing that context of, this isn't something that I can just get over or it's all in my head. This is something that really does need focused intervention. And given the circumstances, you may or may not be able to get access to those interventions. And so that is something you're dealing with and having to figure out day to day how to overcome that.
Thank you so much. We have several questions that are coming in to kind of rapid fire. So I'm going to try to get to as many of these as we can. The next question is, can we apply this mindset change strategy to all patients, and not just COPD patients, but maybe
Oh, yeah.
cardiac patients as well?
Yeah, these are all patients. This is something actually I think we can all benefit, and we all need to do it. And as I said, I don't, I've had to use these strategies and appreciated the reminder to actually putting this together and reminding me that I need to do this. This is a really simple strategy, cognitive strategy that we can use in a lot of situations. The reason why I particularly recommend it to individuals with COPD is given the link between those anxiety depressive symptoms on the respiratory symptoms, and there's actually an increased need for COPD patients to really practice this to avoid those increased respiratory pulmonary symptoms. But this can be used for everyone. It's something that I use and I teach my kids. And to be fair, I've actually seen some discussion about this on, amongst my friends on Facebook, as we're all dealing with this need to re-change our mindset around COVID, to kind of help reduce those symptoms. So there's a particularly strong reason for patients with COPD to learn how to do this, but this is something you could talk about with everyone as we're dealing with this stress. And in fact, we're tailoring this, and I'm presenting it to the healthcare workers, the nurses and the physicians that are dealing with COVID, of how they're dealing and coping with the stress that they're under. So this applies to everyone.
Thank you. Good point. I mean, this really isn't a disease-specific plan. I mean, this really does work for everyone because we are all dealing with this stress. You are so right. The next question is, what about people who may be anxious because they are not able to visit with their physicians like they normally have been able to? They're kind of missing that contact with either their primary care or their pulmonologist, or even just their normal support network. How would you encourage people to, or reassure them even during this time?
No, I mean, I think that's a real big strain and stress that we are not adequately, that's kind of being under discussed right now. And I will say that, I've talked with the pulmonologist providers here at Hopkins, and, at Johns Hopkins, many of them have converted all to telemedicine visits right now, or restricting outpatient visits except in urgent need to prevent exposures. And they're all really worried about not being able to have these visits with their patients and things like that. So I know it goes both ways. So one, I think, is take advantage of telemedicine if it's available. Call your doctors. They're figuring out systems. It may not be the way we're used to, but there are systems in place now to help address this and to talk with patients and to do these telemedicine visits. And in fact, it might be easier than your traditional method where you had to go in to see the doctor. Now you don't have to drive, and it could be an actually easier way to get in contact with your doctor.
That is true.
Yeah. And actually, talking to some of the physicians, and they're like, we've been trying to set this up. Everybody's been trying to get telemedicine off the ground for so long, and there's been a lot of policies and bureaucratic regulations around it that are now going away. And so I think now it's like, hey, this could be actually have a positive outcome, that telemedicine may be more available long term to avoid those stresses of having to go to the doctor. I think there's actually, one of the patients I was talking to about this actually said, I actually really have enjoyed doing telemedicine visits because now the doctor is seeing where I live my life instead of me seeing where the doctor lives their life. And so when he asked me a question about my medications and I don't know the answer, I can go over to my bathroom and pick it up and show it to him. Or they're concerned, if I have something that I need to show them, I can show it to them right there. And so there is some benefit. And I think we just need to, there's some technology issues and everything as they're sorting it out. But I think pretty soon there's going to be actually a lot of benefit to these visits, to being able to have the patients show, be able to demonstrate where their medicines are, what medicines are using. If you've ever gotten confused about which one's which, you can go and double check and have that ability. So I think there's some strengths there. And then loss of other support groups, as I think we have to be creative of how we engage, with other support groups, whether it be we, go online to support groups and chat groups. I know there's a lot of Zoom conferences happening, or even attending webinars like this to find that support is important. But yeah, I do know that, the loss of that outpatient contact with the doctors are there. Know what's keeping you safe, that find being patient with the technology, but I would really feel like I'm actually hopeful that telemedicine will actually take hold, because I think it will actually have some benefits long term.
I'm hopeful too. I really am. I think it could really have some wonderful benefits for our population in particular. I actually have a question for Karen. Let me see if I can get Karen's line unmuted. Karen, are you there?
Oh, yes. Hi. I am.
Okay, hi. Great.
Hi.
So here's a question for you. It says, I like going out for walks, but people seem to not respect distance and want to come right up and talk, but it makes me panic. How could I handle this situation? And so we just kind of wanted to put that question to you and see if you've had anything like that. How did you handle it? What would you do?
Yeah, I have had that happen. If it's someone you know, which hopefully normally it is someone you know, you can just kind of smile at them and say, hey, I'd love to be close enough to give you a hug too, but it's not safe. It's not safe for me. It's not safe for you. We need to respect the 6-foot distance. So I'm going to move away till we're 6 feet apart. If it's a stranger, I basically say the same thing, but maybe not necessarily with such a smile. I may say, we're supposed to be 6 feet apart and we're not. Let's see if we can make this distance a little farther. I think most people respect it. Americans aren't, well, I shouldn't say Americans. People in general sometimes don't realize how close they are to another person, that they're actually in that person's space and that they're making the person uncomfortable. And then you add the 6-foot distance, and that's hard for some people. I don't think they do it deliberately. Right. So I think a smile and just say, hey, let's see if we can't be 6 feet apart, because I want to talk to you. I don't want to run away.
I could also just recommend that, just being mindful of, making sure you wash your hands when you come in from a walk. That's honestly the most likely transmission is if they get close to you, you get it on your hand and then you touch your face. And so, I think having, being careful about that. Considering wearing winter gloves or something so that you can take those off before you come in the house, just to be a little bit more careful. And then I think being conscientious of where we're picking to go for walks. I live here in Washington, D.C., and it's cherry blossom festival. So everyone went out to go walk around the cherry blossoms. And we had to shut it down because there was too many people. And so now would be a time where you need to walk, drive to a little bit more of a more rural area to stay away from people, or choose a different walking path if it's too crowded as well. Then you could be nice, but I'm okay with just saying, no, stay away. My friend had a 2-year-old, they were out walking and the stranger was talking, was just being sweet, and then went up to give the 2-year-old a high five, and she had to just say, no, stop.
Oh, no.
And so I do think we also just need to be more, don't be worried about saying stop if you need to.
Okay. Right. Thank you. And Dr. Egan, I have 2 more questions. And also thank you, Karen, for that answer. And Dr. Egan, this question will be for you. What do you think of the Calm app?
Oh, yeah, so that is one that is available. And to be fair, I get it free. And so I have been using it. For those who are not aware, the Calm app is an app available on your phone, and it walks you through breathing exercises, different meditations, different mindfulness things to help reduce that response. And so I today focused on the cognitive strategies to reduce that response. There are other things of, practicing relaxation that will reduce that arousal response, the stress response we talked about. And so the Calm app is one that kind of walks you through. And so I hesitate to recommend apps because I don't want people to feel like I'm telling you should pay for something or whatever. But if that's something you're interested in, I really recommend it to practice those types of strategies right now to help, when you can't control your thoughts, you can't control the situation, to just kind of hopefully learn to relax your body and that arousal to avoid that kind of spiral. There's lots of different ones. The Calm app is available. There's another one called Breathe, which walks you through different breathing exercises. And so
along those lines, would you recommend pursed-lip breathing and diaphragmatic breathing for someone that's experiencing?
Yes, I was going to say, yes, pursed-lip breathing or diaphragmatic breathing was exactly what I was going to say, is you can definitely practice some of those breathing strategies that you might learn to help, reduce that anxiety. The breath is really linked to that emotion. It is a direct connection. And so the more you can get in control of your breathing, the more you're going to reduce that response. But, given that everybody's COPD is different and where they're at, finding the strategy that works for you is what's recommended.
Great. Well, I think that is all the time we have for questions today, and we really appreciate all these great questions and encourage you to continue to ask them on COPD 360 Social as well, especially if you're listening to the recording of this webinar. You can also email statecaptains@copdfoundation.org if you are still seeking answers to your questions. So we're going to conclude today with just a few reminders of some resources that are available to you. And first, we're going to start with resources, some reminders of resources for staying engaged. You'll find a list here of some of the sites that our team has found helpful to stay engaged and maybe learn new things, even when we can't go out. So these are just a few of the growing list of free resources that are being created. I don't know if you've been online lately, you will know that there are talented artists, musicians, trainers, museums, and more that are creating new content. There are new Facebook groups set up for all kinds of different interests when people are sharing their own tips, their videos, offering skill lessons, recipes, and more. So, really encourage you to reach out and find some resources to keep busy, stay engaged, and this is in addition to being able to put into place the strategies, the cognitive strategies that Dr. Eakin has talked about today. Also, don't forget that you can use any number of free video chat platforms with your smartphone or tablet or even laptop computer so that you can stay connected with your family and friends. And they aren't just for talking. So you can set up a video call on your computer to play board games, share a beverage or more over video, just as if you were together in person. And maybe it's not the same, but it is certainly a good in-between during this time of restrictions. I know personally, we shared a dinner with a cousin over video. We had our laptop set up at our table, and it certainly helps to ease some anxiety and feel a little bit of normalcy back in our lives. So we'll be doing more on this topic in the coming weeks in COPD 360 Social. And so now, I just want to close by reminding you again that you are not alone and that we do hope you'll continue to engage with us and with others in our community on our website and at 360social.org. On our website and on 360 Social, you'll be able to ask and answer questions from other members, patients, caregivers, respiratory therapists, and more. I encourage you to check in, share how you're coping, share your tips for what went well and what maybe didn't go well. So we all need to hear that as well, so we know we're not alone. Check our blog for updates, and then tune in for more webinars, webinar follow-ups, Facebook Live chats, and more. So we also hope that you'll visit our coronavirus information page to access new resources. There you'll find the recording from last week's webinar, a full list of answers to the questions that were received, a new recorded question and answer chat answering some of the most common questions with Dr. Byron Thomashaw and Dr. Barbara Yan. And we'll continue to provide updates and to expand our resources as the situation evolves, including hopefully some new content to help you stay active and exercise in the coming weeks. So with that, we're going to close today, and I just want to reiterate my thanks on behalf of all of the COPD Foundation team to Karen and Dr. Eakin for joining us today and sharing these really practical strategies. So with that, thank you all, and be well, and we will be in touch again soon. Thank you.